Hello, I would like to welcome you to the Duke Tobacco Treatment Education Program. This program is supported by an independent education grant from Pfizer. Here's a list of disclosures, including government support and also support that I receive from other places. And here's the team that we has helped put this together. I am James Davis. I'm a physician at Duke University. I'm a practicing physician who sees only tobacco users at this point. I'm also the medical director of the Duke Center for Smoking Cessation and the director of the Duke Smoking Cessation Program. The first is a research center and the second is a clinical program. Dr. Scott Swartzwelder is a full professor at Duke and specializes in addiction with hundreds of publications on tobacco dependence and other forms of addiction. Nick Hudak specializes in education of medical providers, specifically international education of medical providers, and works as a part of the Duke PA School. Jillian Dirks runs the tobacco treatment program here at Duke and also oversees training at Duke. And Liz Molinari is the facilitator for this program. I just want to give an introduction to kind of why we're doing this program, why we think that it's important, and kind of where this program will be provided. We'll be providing this program for 4 different regions: South Africa, Saudi Arabia, Egypt, and Gulf countries, with the objective of really helping medical providers have a more substantive and evidence-based understanding of tobacco treatment so that they can provide that treatment in their communities. Smoking continues to be the #1 preventable cause of morbidity and mortality around the world. Unassisted smoking abstinence rates, when people try to quit on their own, are under 5%, and it ranges between 2 and about 4.5%, depending on psychiatric comorbidity and other challenges. But really very poor outcomes when people try to quit on their own. These are massively improved when we have evidence-based treatment. In fact, programs like those at Duke, UNC, MD Anderson are generating smoking cessation abstinence rates in the 30 to 40% range, which is really possible with a good understanding of treatment processes. This is nearly 10 times the abstinence rate that people are able to achieve on their own. Most physicians and medical providers receive an hour or less in training in tobacco dependence. It is very meager training considering the magnitude of this problem. There's also a large amount of evidence that's really been developed in the last several years around tobacco dependence that has provided guidance that enables us to increase abstinence rates and just do a much better job than we have before. Who's running this course? This course is being run out of Duke University, the Smoking Cessation Program, the Center for Smoking Cessation Program. Duke also runs the Duke UNC Tobacco Treatment Training Program together with UNC and our partners with the state. Pfizer is supporting this training program, but will not be providing content. The course structure. So, in essence, what we want to do is provide you with a series of videos that you can watch on your own time and then come together for a 3-hour period during our first week and really talk about the information from those videos and work through patient situations, case reports. So there's going to be 5.5 hours of video for the first week, followed by training with a lot of kind of case situations. In week 2, we're going to step into, we're going to do more video-based training, also followed by web-based training. Technology platforms include Sakai, where all of the course materials will be held, and you can reach out to Luz Molinari, and we'll give you contact information in a second, to figure out those course materials. And then the interactive trainings, web-based trainings, will be done through Zoom. And so you want to make sure that you're able to use both of those platforms in order to get through this content. The first week, and we'll talk about the second week later, but the first week objectives, I'll just walk through these. So the part one, and this is actually a description of the individual videos, and this is the time length that each of these will take, and it comes right out to about 5.5 hours. And let me tell you a little about each one and objectives. In part one, we'll be talking about types of tobacco use and what's in a cigarette. And my hope is that you will have a sense of not only smoking, but other forms of oral spit tobacco or orally used tobacco, and then also different types of smoked tobacco, as well as newer products like e-cigarettes and heat-not-burn products. And so that you'll really be familiar with all of the forms of tobacco that your patients come in to clinic with. I also want you to understand some of the toxic chemicals in cigarettes and how that works to generate pathology. In part two, we'll be diving into pathology, and we'll be looking at pathologic processes in the lungs, in the vessels, in the cells and tissues, and in the DNA, which of course leads to cancer, and hopefully work through that to broaden your understanding of the impacts that smoking has in your patients, in your treatment population. Next, we'll look at neurobiology, which is really a dive into what makes nicotine so addictive. And we'll talk about the way nicotine binds in the brain, the kinds of changes that happen in the brain as the brain adapts to nicotine, as people become dependent on nicotine. And we'll look at withdrawal, and we'll also look at connections to our environment through triggers. In pharmacology agents, part 4, we're going to look at each of the FDA-approved pharmacology agent, as well as several others that have been found to be effective and are commonly used for tobacco dependence. We'll talk about how those agents work, how those medications work, the side effects associated with those medications, and reasonable approaches to using those medications. Again, I hope that this helps in your understanding of how to use these medications. Part 5 and 6 are pharmacology strategy, and here we're going to go into considerable additional depth than what most physicians and providers normally learn about how to use these medications to generate higher efficacy rates with your patients. We'll get into contemporary treatment, which is all of these treatment approaches, and then we're going to look at special populations in part 6 and talk about what to do with hospitalized patients, perioperative patients, patients with various psychiatric challenges, patients with renal failure, or cancer patients, all of these kinds of challenges that we often run into in our practice when we work with complex patients. What could you expect would be possible after a course like this? The first thing that I would expect and that I would hope for you is that your own efficacy as a provider would really improve when you're treating tobacco dependence. That you would be able to meet with patients and generate abstinence rates and success rates with your patients that are considerably higher than what you're able to do or what colleagues are able to do who are not trained in this kind of treatment. The other thing is that I expect you should be able to identify yourself at your institution, at your clinic, wherever you're working, as a local expert in this area, as somebody who actually has a background of understanding in tobacco treatment and can be used as a resource and can receive referrals from other providers. The other thing that I think you should be able to do after reviewing these informations is really provide information on tobacco treatment to the community. A lot of the information that we're providing here is information that can very quickly be turned around to talk to other clinicians, to talk to educators, to talk to other populations in community outreach. And finally, I would like to be able to give you the tools that would open the door to program development, to really establishing programs that are dedicated to tobacco treatment within clinical constructs like a hospital or health system or public health center. I think that that's it for the general information about the course. Contact information for us, and many of you have already seen this. The program email address is quit@dm.duke.edu, and that's probably the best way to get a hold of us is through that email address. You can also call a phone number. You'll want to use, if you're calling from out of the United States, you'll want to use the U.S. Prefix. Then the program website is sakai@duke.edu, and that brings you, of course, into the Sakai platform where videos are held. And then the Pfizer website is listed below also if you want to use that. I really hope that you have a terrific experience with this. We've really spent some time trying to create a course that is helpful for clinicians to really bump up the level of treatment that is that's possible for you. And I look forward to talking to you soon.